Good evening, everyone, and welcome to this evening's webinar. My name is Dr. Wairimo Mwaniki. I am a consultant physician and the convener of the KMA Policy Advocacy and Communications Committee. It's my pleasure to welcome you to this evening's webinar titled Transformative Healthcare Leadership in a Changing World. Just some housekeeping rules before we begin. Please keep your microphones on mute during the session, and questions and comments are welcome. You can put them either in the chat box or in the Q&A box. This webinar is hosted by the KMA Policy Advocacy and Communications Committee, and this evening we aim to explore the ever-evolving landscape of healthcare leadership. Some of our objectives are to examine what it takes to be an effective leader, how to manage teams and influence policy, all while embracing the dynamic nature of the healthcare sector and the need for up-to-date leadership strategies. We've brought together a brilliant panel, and we are excited to have them here with us, and I have the great pleasure of introducing them to you. So Dr. Frederick Ephraim Mukabi is a governance and leadership consultant with over 30 years of experience in the public service. He currently serves as the Deputy Director of Learning and Development at the Kenya School of Government, Embu campus. He holds a PhD in governance and leadership and has led numerous research projects and consultancies. Dr. Mukabi is an expert trainer and published author in the fields of research, governance, leadership, and institutional reengineering. Welcome, Dr. Mukabi.
Thank you, Catherine.
Karibu sana. And before we kick off the formal part of the webinar, we'd like you to tell us, what do you do to recharge after a busy day working with teams?
Yeah, thank you, Catherine. I do quite a number of things, but one of those that I must definitely do at the end of the day is to listen to some soothing music. That is almost like standard practice so that I'm able to relax and probably unwind after a long day. Thank you.
Thank you so much for sharing. Our second speaker is Dr. Raphael Chuzi. Dr. Chuzi is an organizational psychologist and associate professor at the University of Toronto, Mississauga. His work focuses on team dynamics, psychological safety, diversity, and emotional decision-making. With over 15 years of global consulting experience, he has advised healthcare, corporate, and government organizations across Africa, Europe, and North America. A three-time TEDx speaker and published author, Dr. Chuzi is known for translating research into practical leadership tools. He also mentors early career professionals and advocates for evidence-based policy. In his free time, he enjoys traveling and exploring cultures through food. Welcome, Dr. Chuzi.
Hello and
Please
welcome.
tell us.
Thank you for having me.
Thank you. Thank you for being here. And please tell us, what's your favorite international dish and why?
My favorite international dish. So I'm originally from Brazil. So now that I'm living in Canada, I don't know if I consider my home country my international dish because I think I would be allowed to do that. So it's called feijoada. It's a Brazilian dish, which was interesting. Was developed by was created by slaves when they had very little resources. So it's a combination of beans and different parts of the pork like ears, snout, all that good stuff. In Canada, it's not very common, but in Brazil, we love it.
Thank you. Thank you for sharing and welcome. Our final speaker needs no introduction in the healthcare space, both locally and globally. Dr. Jackie Kitulu is a distinguished health leader with over 20 years of experience in shaping healthcare systems in Kenya, Africa, and globally. She's the current president-elect of the World Medical Association and has held key roles, including being the president of the Kenya Medical Association and director of the Kenya Healthcare Federation. She's a practicing family physician and holds an MBA in healthcare management from Strathmore University Business School. Dr. Kitulu has led national policy reforms. She's secured major health grants and served in senior government advisory roles. Her work in governance, health policy, and ethics has earned her top honors, including the Moran of the Order of the Burning Spear, the Order of the Grand Warrior, and a Lifetime Achievement Award from the Kenya Association of Family Physicians, among many, many others, for her service to the medical profession. She continues to champion universal health coverage, ethical medical practice, and resilient global health systems through her leadership on various national and international platforms. Thank you for being here, Dr. Kitulu.
Thank you very much, Dr. Wairimu. I am so delighted to be with you.
So please tell us, how many countries have you visited so far, and which is your favorite?
How many, what?
Countries
Oh,
have
wow.
you visited?
Oh, I haven't counted. Oh, yes, actually, that's an interesting question. I think there's one of those things that pop up on social media that asks you to tap on the countries. And I think, okay, because I was recently in Uruguay, next to Brazil, where Dr. Chiuzi comes from, that will make that, I think, my 28th or 29th country. Yes. So about 29 countries, I think. Yeah. And which is my favorite? Okay, I think all the countries have been interesting in that they all have different vibes, but maybe I'll say the favorite from the point of view of the place that I felt that I could call home, that if I didn't live in Kenya and I had to live somewhere else, interesting enough, it was Australia, Brisbane to be precise. I think it just felt more like home. And so as far away as it is, I count it my favorite because it's the place that I most felt at home. Thank you.
Thank you for sharing. So now that we've gotten to know a bit about our speakers, we'll move on to the main presentations. And I'll start with you, Dr. Mukabi. I'll give a preamble to your talk so that our viewers can understand where we are coming from and what our discussion will be about. So leaders in healthcare or in any space cannot succeed alone. And building and leading effective teams is crucial in improving patient care, implementing policy, and driving institutional change. Leaders need to set clear direction for their teams. They need to align individuals to a shared vision and inspire teams to navigate challenges, all while delivering results. So in your role as Deputy Director of KSG MO, you have interacted with many leaders across the public and private sector. And based on your wealth of experience, could you tell us, do you think leaders are born or are they made? And while you talk about that, can you also tell us what the key qualities of an effective leader are and how an effective leader can cultivate inspiration among teams to drive institutional transformation? And also, could you also tell us how having a strong and efficient team is essential for leadership success in healthcare?
Yeah, so thank you so much, Dr. Wairimu, and my colleague panelists, and all the delegates present. Allow me to share a presentation in a bid to actually react to the questions that Dr. Wairimu has just posed. And I hope you're able to see my screen, right? Yeah,
Yes.
so I'll just make a brief presentation, and then on the basis of that, probably we can be able to get some reaction from those in the room. For starters, yes, it is true, at Kenya School of Government, where I work, I've had an opportunity to meet quite a number of diverse leaders, particularly in the public service. And most of what I'm going to be discussing is actually based on that kind of experience. I've had an opportunity actually to meet quite a number of medical officers at all levels in some of our popular programs like Strategic Leadership Development Program and Senior Management course. And we normally give them some generalized guidance in terms of really what leadership is and really how they need to unpack their leadership capabilities. So what I'm going to present is more or less what we ordinarily do, but I'll try as far as possible to skew it specifically to the healthcare sector, so that again, we are all able to see the relevance of the discussions, and then thereafter we can get some reactions. So, why is my, okay, fine. I hope you are able to see. I was just getting agitated because it was kind of sticking out. So I want to begin by posing this question, and the question is based on what you can see. This is the Kenyan map, and it reflects what I would ordinarily refer to as the current state of some, if not most, of our health facilities in Kenya. And from this kind of word graph, it is evident that for us to experience some of these challenges that are coming out here, right from the corruption that is coming out so loudly, then probably there is a high incidence of a leadership gap that is existing, because some of these issues, every other day, you listen to the news, you read a newspaper, you would always be able to come across some of these descriptions relating to some of our healthcare facilities. So the kind of discussion that you're going to have is actually going to relate to what Dr. Wairimu has posed as a question. But again, we're also going to draw certain examples based on experience, both from my end and also from the end of the participants. So this is what I want us to discuss around. I just have got those 4 bullets. The first one relates to what the convener has raised, that is on leadership. And I'm simply posing the question, is it about traits or is it about training? So on the basis of that, we can be able to agree on whether it is on traits or training. And then 2, I would also wish to take us through the team dynamics and leadership. And I normally use what you refer to as the DISC model to discuss around this, because then it helps us to unpack some of the psychological influencers towards different individuals with a team, and how a team leader can be able to utilize that understanding to be able to work effectively with a team. Then thereafter, I would also look at a transformative leadership in healthcare services, so as to be able to address really what is it that we need to do to ensure that there is that kind of transformation from the way we are operating in terms of healthcare provision and management of our facilities, and the kind of leadership that is there, and really what should be there. And that relates to what Dr. Wairimu mentioned about what are some of the qualities that those we bestow with these kind of leadership opportunities, how exactly should they operate, or which attributes should they possess. And then finally, if you allow, because I work with Kenya School of Government, I would also just like to share with the participants here some of the programs that we offer and which are meant to address very specific leadership needs, so that all of us can be able to appreciate in a way of looking at how formal training can facilitate the development of leadership within the healthcare systems in the country. So I'll quickly move on to the concept of leadership, which may not necessarily be anything new to many of us, but I would just want to say that when you talk of leadership, we are simply trying to define what the future should look like in terms of our facilities, in terms of our systems, in terms of our health professionals. So we want to look at how the future should look like, how it is able to align with that particular vision of what the future should look like, and also the aspect of inspiration, so as to be able to make it happen, because you cannot be able to have that kind of vision, that futuristic model of what you really want to have, unless, again, you are able to inspire or effectively communicate so as to overcome some of the imminent challenges that can arise in the event that you want to realize this. So I'm quoting John Cotter, who actually tried to give that kind of description. But the World Health Organization, in one of their pieces, that is transforming and scaling up health professionals, education and training, actually says that leadership, and particularly in healthcare services, actually refers to the process of guiding and influencing individuals, teams, and organizations so as to be able to achieve common goals of improving service delivery, also ensuring better health outcomes for patients and also communities. So WHO, of course, gives a directional type of definition in terms of what leadership should be, and it is about influence, and that influence of teams is meant to support the realization of better health services, coming up with systems so that at the end of the day, the welfare of our patients then should be able to come out as having been addressed. So having said that, then I want to delve into the question that our convener, Dr. Wairimu, has posed, the big question of whether leadership is inborn or whether leadership is through development, that is through schooling and training and what have you. And I want to confirm that this debate has been there for quite some time. The question is, are leaders made or they're born? And that is why we say that the debate on whether leaders are born or made is actually a long-standing, long-standing in leadership studies, and especially relevant in the context of healthcare service leadership, whereby it is known that indeed effective leadership is bound to directly influence what we refer to as the patient outcomes, the staff morale, and systems efficiency. But having said that, it will be good to clearly appreciate that leadership can both be innate, and it could also be as a product of the kind of exposure you have in terms of the environmental support, the environment, how the environment is able to support you to develop. And that is why, ladies and gentlemen, we are saying that in this context, actually both perspectives, that is whether it is inherent or actually acquired, they hold, and we are going to see how this comes out. There is what you call the trait theory, and I'm sure quite a number of us have been able to access these. The trait theory actually argues that leadership is not a learned quality. It is a quality that some individuals are born with. And we're just being careful that it is a quality that some individuals are born with. And actually, Thomas Kalin, what he argues in this great man theory, which is actually a classical piece, is that certain individuals have got certain inherent characteristics. And if you observe even some of these lower animals, you can always be able to tell an animal that has got certain abilities probably to provide leadership in case of certain situations. And even when you look amongst us in communities, and even our children when they're growing up, you'd be able to see that there is this child who has got this apparent ability to be responsible whenever situations pop up. And it's on the basis of these kinds of observations that the trait theorists actually argue that by far and large, this leadership is actually innate. In other words, we subscribe to what whichever genes that support us to be able to provide leadership. And this view holds that leadership is actually a result or of what you call the inborn characteristics. And in the context of the healthcare systems, we can say that natural traits such as what you refer to as emotional intelligence, resilience, decisiveness under certain conditions. If you are able to find certain individuals that are able to become under very extreme circumstances, probably we have got a scenario where it is a near crisis, but they're able to manage teams, even those teams that are agitated, or they're able just to manage themselves under certain very volatile conditions, and even the ability to withstand that pressure and also take a position under very difficult circumstances. You'll find that some of these attributes, more often than not, they're actually someone's personal characteristics. I say that because I've seen situations whereby individuals, despite their level of education and training, up to the top-notch leadership level, you'd find that they still have challenges with some of these attributes. Yes, emotional intelligence could be wanting, resilience, yes, and then of course, so you'll find that some of the circumstances can actually clearly tell you that, yes, this individual has undergone all these, but still there is quite a challenge. So this kind of thinking therefore supports the notion that the trait theorists would be having a very strong point that your innate characteristics are the ones which direct you to be a leader. But again, there is a disclaimer that you can have those innate characteristics, but you need to redirect them towards the kind of system that you are operating in. And in this context, we are talking about the healthcare environments, which are fairly complex, I must appreciate. And by virtue of that fact, you might have all those abilities, but again, they need to be nurtured in a way that would really be able to fit into the unique circumstances that you are exposed to whenever you are holding some of those leadership positions. And then, of course, the counter argument here says that the skills that is under the skills and situational perspectives, they dictate that leaders are actually made. And the arguments are, and especially what Vince Lombardi argues, he says that leaders can be developed through education, they can be developed through training, they can learn through experience and mentorship. And in the context of our healthcare services, for example, clinical competence alone does not guarantee leadership ability. And I want to say this from experience, that I've had an opportunity, and probably Dr. Irimu can bear witness. I think I posed this question when I was in one of your classes, that a young medical officer, after leaving a medical school and after going through the internship, the next thing that happens is that this medical officer is assigned to be the medical superintendent of some hospital in some far-flung part of the country. And when you observe the struggles that this officer goes through on the basis of, yes, I've been in class, I'm nicely exposed, I've got all the education that warrants me to understand the environment that I'm going to operate in, but the dynamics, the leadership dynamics at that particular station would say otherwise, because when you are dealing with people, when you are dealing with the resources, it's a completely different ballgame altogether. Some of the things that you may never have been told about in the medical school. How do you interact, for example, with the rest of the agencies within that environment? How do you manage, for example, financial resources? And so you might find that some of those challenges actually pose a major threat to the way or how effective some of these officers become. And therefore, we may argue and say that a nurse actually might arise to a leadership role through training on healthcare management. And this happens, by the way, I know you know. Then, of course, there is always that constant mentorship from senior staff, but experience carries the day, because when this individual is being handheld within that kind of junior position, then they learn the ropes. They know how to handle certain situations, so that at the end of the day, again, they are able to effectively manage and provide leadership whenever it is needed. And when now we move away from general and maybe just touch base with the Kenyan situation, we agree, and it is a near statement of fact that we have cases that clearly demonstrate that certain individuals have got certain inherent leadership qualities. And these individuals can be found amongst us. And these leadership qualities make them have the ability to manage some of the situations much better than their counterparts, whom even they graduated and moved in the promotional ladder. Even when they have been exposed to similar trainings, you will find that these ones are outstanding. And in this case, we can only attribute some of these variations to the fact that some of these traits are actually inherent. But again, we cannot overlook the fact that training, certain exposures. For example, when you take some of these officers through trainings, it builds their capacity to be able to know exactly how to react under different circumstances. So once that is reinforced, then it becomes much easier. And that is why I say that some of the leadership programs that we offer actually are able to support these kind of abilities, so that, again, our leaders can be nicely nurtured within the environment. Then, Madam Chair, allow me to drift now and touch on team dynamics before I come to the leadership qualities. And the term team dynamics can be looked at in various contexts. And there are those contexts that just reflect that teams can graduate from a certain disorganized lot towards becoming a highly performing teams. There's that kind of thinking. And I would like to skew my argument towards another line of thinking. But even before I do that, I just want to touch base on what I would want us to consider as team dynamics, so that even as we get into the details of the model that I would want us to use, then we should have at the back of our minds exactly what team dynamics in this discussion is all about. And I'm making reference to what WHO says, that these team dynamics are actually the unconscious psychological factors that influence the direction of a team's behavior and performance. Take note of the word unconscious psychological factors. They might not be observable. They might not be known even by the team members. And therefore, it becomes critical that we look at it from that kind of perspective. And therefore, we are saying that in context, therefore, it means how healthcare providers, such as the medical officers, the nurses, the pharmacists, all these teams are able to support staff that in terms of collaboration, how they're able to make decisions, how they're able to resolve conflicts, how they're able to coordinate their roles with the sole objective of ensuring that the objectives are realized. So you might find that different individuals exhibit certain traits, certain characteristics. Some of these characteristics may not be known to these individuals. And by virtue of that fact, if you from your end, you're able to observe some of these characteristics, then it makes your life easier, because on the basis of that, then you can be able to provide an antidote in terms of how best can you utilize someone who is exhibiting these types of characteristics. And we take note that positive team dynamics, and for each aspect of the dynamics, there is a strong positivity about it, as we shall see. Positive team dynamics are critical in reducing what you call medical errors, supporting or improving patient outcomes, and also fostering what we refer to as a culture of safety and respect. I know you can appreciate that much better than I do. And in the context of that kind of background, I want us to use a model, and this model was developed by a classical contributor by the name William Moulton Marston as early as the year 1928. And actually he came up with a very useful model for team leaders that has actually been used for quite some time. And in his thinking, this model, he calls it the DISC model. It actually helps us to predict behavior on the basis of the DISC personality traits. And the first being what he referred to as dominance, then the next being influence or inspiring. The other one is actually being steadiness and supportive. And then the last trait is on compliance, or if you like, hiyo maneno ni ngumu sana. English is not my mother tongue, but at least I can be able to spell it. So our ability to clearly classify our team members into the categories of whether this individual, this medical officer, this nurse is falling within the dominant category, whether they are falling within the influence or inspiring category, and all that. That is the first step towards understanding them and making the best out of them, according to the arguments by William. So he used this kind of graphic to demonstrate these, that those who fall under D ordinarily are results-oriented, they're innovative, they're competitive, and they're also direct. Those who fall under I are people who are people-oriented, they are enthusiastic, they're optimistic, and they're also creative. And then those falling under C, those who comply tend to be very accurate, they tend to be very cautious, they're also precise, and they're fairly analytical. And then those who fall under S are actually individuals who are sincere, they are dependable, they are loyal, they are patient, and they are also modest. So it is now very easy for you as a leader to try and look at the various subordinates whom you work with within this kind of framework, so that on the basis of where exactly they fall, then you can actually know how best to handle them. But it will not be sufficient for you just to know that this is a results-oriented person, these are the innovative person, because each one of them, again, has got their pros and cons. They have got their advantages and disadvantages. I have highlighted this for you. For example, those fellows who have got a dominant trait, and I'm sorry to say I fall in this category. They tend to be very direct, they're decisive, they're ego-driven, they're problem solvers, they're risk takers, they like taking new challenges and freedom from routine. They're driven to overcome obstacles. I find myself in this kind of situation many times. In some cases, it has caused me problems, but overall, I think it has worked for me. So as part of the strength of this, you find that these guys are great organizers, great time managers. They like challenging the status quo. They're fairly innovative for that matter and creative and all that. But their weakness is they're fairly argumentative. They can actually be disrespectful to authority. And being disrespectful, when you challenge the status quo, and particularly for us in the public service, when you challenge a senior medical officer that, you know what, there is a better way of doing what you are doing. If only we can do this on the basis of what I read the other day. Someone can easily assume that you are being unnecessarily disrespectful if they are not nicely founded. And then, of course, they're also ambitious. They can also be very blunt, stubborn, and also aggressive. Ladies and gentlemen, if you didn't know me, I actually fall in that category. Then under inspiring or influential, these team members are enthusiastic, they're persuasive, they're optimistic, they're trusting, they're impulsive, they're charismatic, they're also emotional. Now, their strength, of course, we say they are They are creative problem solvers, they are great cheerleaders, they are negotiators, they are peacemakers, they are people's persons. I mean, there are these people who, like, I can see under the staff who work under me. I can also be able to categorize all those people who fall under this category. Now, these characters are more concerned with popularity than tangible results, and they're not very keen on detail. Anything goes so long as everyone is happy and all that. So you need also to be able to identify and categorize them. Then there are those who are steady, or if you like, supportive. They are reliable, they are predictable, they are friendly, they are good listeners, they're team players, they are empathetic, easygoing, they're also altruistic, and all that. Their strength is that they're dependable, they're loyal, they respect authority, they have patience, they have got empathy, they're good at conflict resolution, they're always willing to compromise. But now this cadre of people, hao ni wale watasema wewe usifanye hivi, mkubwa alisema tusifanye namna hii. So they kill creativity. So they are resistant to change. They are very sensitive to criticism. And they are also difficult in terms of knowing what should happen, as that is according to this DISC model. Then, of course, the last category, which touches on the cautious or compliant category, their characteristics is that they like observing standards. They really adhere to the values. They are fairly analytical. They are even-tempered. They're realistic and all that. This is where we find the researchers. These are fellows who are able to define situations precisely and accurately, and they also offer very realistic perspectives. But again, their weakness is that ordinarily they are bogged by certain details. So why am I bringing all these up, ladies and gentlemen? First, it is important to have a way of knowing the people that you are working with. And like we said earlier, these are unconscious type of attributes that are being exhibited by these individuals, but they are observable from our end as their leaders. So on the basis of that, therefore, it becomes very important that then we should be able to use that kind of understanding, for example, to know where to place who, because the work of a leader is to know their people and know that this one can perform very well under certain circumstances. This one, because he's a go-getter, give him these kinds of opportunities and they deliver. This one, because it's a yes person, there is a way we can be able to ensure that, again, we are able to maximize on them. So on the basis of their strength and their weaknesses, then you should be in a position to actually know how to categorize them. So last but not least, ladies and gentlemen, allow me just to have a discussion around transformative healthcare leadership, which will touch on the issue that was raised by our convener in terms of really when we are looking out for individuals who have got these leadership attributes, what exactly should they have as leadership attributes? And I want to observe and agree, because I happen to have friends who work in your sector, and we are great buddies, and even some of my siblings, and they keep on describing some of the unique circumstances that they operate in. Of course, you are always being challenged in terms of how do you ensure patients are okay, the issues of management, how do I adhere to policies, but again, there is also that medical ethics and what have you, there are those regulations that are in place. So it is kind of a very delicate balance. And this can only mean that you require certain abilities to be able to navigate through this. This is a balancing act, because at the end of the day, you must be able to ensure that you are able to deliver to the kind of expectations that you have. And therefore, transformative leadership within this category must actually embody a range of qualities to be able to navigate through this. I've got some of these attributes. For example, such leaders, if you must be transformative, then you must have a strategic mindset, because that strategic mindset is what will enable you to know what to do beforehand. It is what will enable you to exploit that which is the environment is able to offer. It is what will help you to have clarity of vision and how to get there. So you must definitely have a strategic mindset. You must also be highly emotional intelligent. Just a bit of being self-aware. I know my weaknesses, I know my strength, all right? That is internal, but even to your environment, the people you are working with, you must also be someone who is also able to empathize and understand what they're going through. The whole issue of having a visionary thinking cannot be overemphasized, that you should be someone who can be able to have clarity of vision, adaptability and resilience. How adaptable are you, irrespective of the prevailing circumstances, whether political, social, or economic? How are you able to navigate through some of these conditions and still be able to deliver nevertheless? How resilient are you? Are you able to withstand certain shocks that come with leadership? Are you able to do that? The whole issue of ethics and integrity cannot be overemphasized, and especially in Kenya. The whole issue of having what you call strategic and inspirational communication. You are not going to effectively support transformation within an organization unless you're able to communicate strategically, you're able to support the realization of certain strategic communication policies, you're able to inspire and all that. To what extent are you able to have a collaborative mindset within the environment? Are you able to explore some of the opportunities and harness them to the benefit of the kind of mandate that you are having within that health facility? We're also saying that your ability to take care of the financial resources is also very, very critical, so that you are clearly understand how best to utilize these resources and all that. And then the whole issue of being customer-centric, of being customer focused. And then, of course, team and what you call self-development. Finally, I just want to touch base with some of the issues that have been raised, and maybe this can just be for your look. That is some of the leadership issues, what the trainings normally focus on at Kenya School of Government and the kind of trainings that are there. So I may not need to belabor mentioning each and every leadership issue, but these slides are just meant to help us to understand that if you have got this kind of gap, then there is this kind of training in a way of addressing the issue of which kind of formal training in healthcare leadership development can actually be realized. So we have quite a number, and I want to believe that at your own free time, when you look at them, you can be able to appreciate, for example, SLDP Strategic Leadership Development Program, SMC Senior Management Course, TL is Transformative Leadership, IR is Institutional Engineering, PR and CC is Public Relations and Customer Care, Supervisory Skills Development is SSD, and all these are meant to strengthen the capabilities at lower levels. So as I come to an end, ladies and gentlemen, I just want to give a quote from Darwin, and Darwin says, "It is not the strongest of the species that survive, nor the most intelligent, but the one who is most responsive to change." Darwin appreciates that transformation, of course, is the father of evolution. Transformation is an evolutionary activity, and it's not about how much education that we have, but it's also about our adaptability to the environmental conditions and harnessing on those conditions that will help us to be able to create what you call the positive changes. So I want to stop at that, ladies and gentlemen. That makes my presentation complete. And thank you so much for listening to me. Back to you, Madam Convener. Sorry if I overstretched Kiasi, but that was it. Thank you.
Okay, thank you so much, Dr. Mukabi, for your interesting talk and for sharing with us what it takes to be an effective leader and how to deal with team dynamics. I'll jump straight into Dr. Chuzi's session. And Dr. Chuzi, you're going to talk to us about change management and how we can handle change as healthcare professionals in this dynamic healthcare space. So could you please walk us through what change management is and why it's critical in navigating the constantly evolving healthcare sector? Secondly, you have one of your TEDx talks talking about the case for psychological safety and better teams. Could you please tell us more about this concept of psychological safety? Maybe some of us have never heard about it, particularly in the workplace. And can you tell us how healthcare leaders can use psychological safety as a tool for effective change management with their teams and institutions? Thank you.
Yeah, I can. Thanks again. Thanks for having me. I hope everybody's doing well, and all healthy families, and happy everybody. I'm gonna try to keep um, some of the things that I have to say fairly brief, and but that is intentional. And by all means, I'm not trying to claim that all of those ideas are exclusively mine. They're a compilation of not only the research evidence that we have, but also part of my practical experience. And so change management is it's a relatively new area in the sense of a discipline. Of course, it's an overlap of a series of other disciplines. So a little bit of management, a little bit of psychology, sociology, operation. You can take many things and put into change management, but it's an organized and systemic way of thinking about how to produce sustainable and consistent change. So if I could put it very, very simply. Um, what I think it's interesting about this discussion here today is that I think change management for healthcare specifically, I think it's essential for a few reasons. One, medicine is an evidence-based field, right? So that means that by nature, this discipline must be structured for adaptation because there's always something new coming up, new discoveries, new approaches. Um, Number two, medicine is it cannot be fully disrupted, right? It cannot interrupt like an ICU care, so it has to be well thought through, and that's why change management is such an important field. Number three, it's a field that depends on 100% on human expertise and motivation to function. So if you don't have the people on board, then it's going to be extremely difficult to get things to happen in a sustainable way. And number four, of course, it deals with novelty. There are many unknown variables. So by definition, medicine it's a complex field. So what I think it's interesting about change management is there is a misconception. It's a costly mistake, in my opinion, that most managers, most leaders, they treat change management as a PR campaign, like a public relations. So what I mean by that is that the leaders make the decision at the top, and then they just come and communicate those decisions to the rest of the workforce. And of course, anyone here in this webinar that have been involved in some aspect of change, you know how dismissive this can look like. You know how offensive it can look like. So the change is treated like a rollout instead of a process. Uh, and the problem is you're treating everybody else as a spectator of your change, and you expect them to comply with whatever you have decided beforehand. So this top-down approach to change management will assume compliance and will almost treat it as equal as commitment, and they are not the same thing. And this is why those things fail. Because if you don't have like take a national healthcare system, right? You have so many intricacies in that system. You have so many blind spots in that system. So a lot of change initiatives, they fail to go all the way down to the granular level to learn from those people. I call this a grassroots approach to change. If you don't at least consult with those people, you're going to be blindsided halfway through. So what do you have to do? You have to go back to the plan. Oh, we're dealing with something new that we haven't, we didn't imagine that would pop up. Of course, you didn't do your homework. You didn't talk to the people who have the dirty hands doing the work. And by saying consulting, I don't mean that you have to abide by everything that you learn, but if you don't know, well, then you don't know. So this grassroots approach to change management is far more reliable. And without it, you have almost like a patchwork, you know? So you're trying to do this, and then you're trying to put together there, and it's very badly sewed. So you're going to have a lot of cracks. Because of that, this is a risk because you're always going to deal with potential catastrophic failures. You're going to deal with errors and omissions and many other negative outcomes, not only for, for the care of the patient, but also for the professionals. And I know this because we have in one of the programs that we have at the University of Toronto, we have our healthcare program for many nations in the African continent, and I hear the same thing over and over again. We're doing this, all of a sudden, this project fell on our lap. Now we are supposed to comply, but we have this and this and this that doesn't allow us to do it like the way they want us to do it. So what do you have to do? You have to work around. You have to patch. So it's not the full solution, and that leaves our health workers who are already overwhelmed, more stressed, not sleeping well, with a excessive workload. So it doesn't help the system. So change has to be treaded very carefully. It has to be very well organized to avoid the change fatigue. And this is something that I find that it lacks almost everywhere. Someone orchestrating the change initiatives. Because look, what I'm saying, it's nothing new what I'm saying to you probably. You probably have had, if you don't have it right now, 3, 4, 5, sometimes 10 different change initiatives at the same time that you have to roll out. You're supposed to roll out if you're managing a department. So there's nobody taking care of that overload of change initiatives, which is going to fall onto you to make a decision. Which one am I going to prioritize? If I don't do this, then it's going to be a failure there. If I don't do this, my boss is going to be mad at me. So in order to have sustainable change, you need to build a change infrastructure within the company. But here's the point, and to Dr. Wairimu's point, one of the topics that I research a lot and something that is very near and dear to me is the concept of psychological safety. And I don't know how many of you have heard about psychological safety before, but it's this concept brought up more prominently by Professor Amy Edmondson out of Harvard Business School, which talks about the perception that you have that the environment that you're working is safe for you to speak up, for you to ask questions, for you to offer ideas without the fear of retaliation, without the fear of being ridiculed or ostracized or persecuted by any means. So whenever you feel safe to expose your ideas, to offer your insights, to ask questions, to disagree with ideas, even if that goes against the grain, then that is a clear indication of a presence of psychological safety. Needless to say that in any change perspective, psychological safety I consider to be one of the most efficient fuels for change that you can have. Because if you establish communication lines with every layer of hierarchy in the organization, starting all the way to on the top, going all the way to the bottom, if these people feel safe enough to voice their concerns, and as long as you're willing to take the feedback and learn from it, well, then you have a secure line to learn everything, every possible hurdle, every possible roadblock that you might face. You just collect them and you learn, and then you make it better. But let's be honest here. Medicine is a field which is highly, highly hierarchical. And some dare to say that it almost works like a caste system, right? And I'm talking about power imbalance between sometimes doctors and nurses. And within the physicians, you have the other hierarchies, more important, less important. So this is very present in the medicine and in the medical field. And I do have in my family a lot of people in the medical field in all levels, and they all, essentially talk about the same thing. So if you, as a physician who were promoted to a leader, to a manager, if you don't have the capacity to, for instance, to put your ego aside, then it's going to be tremendously hard to create a psychologically safe environment, right? Because you're still going to be operated sitting on your throne, and everybody's supposed to say yes to you and be pleasant to you. So you're going to be surrounded by sycophants, by people who were only telling you what you want to hear. That is highly unproductive because you're not learning the pains of the company, of the institution, of the department that you need to change. If you don't know, then you don't know. You're going to hit a roadblock every step of the way. So change management can help as a discipline to organize integration with project management. Yes, it has to be financially feasible, but you also have to understand about people. You have to understand about human behavior. And of course, none of that is going to be efficient if you don't have what we call a change leadership. And this is the one thing that you cannot outsource. You can outsource change management, you can hire consultants, and you can hire big companies to help you with the operation of change management. They can do a bunch of research for you. That it can be outsourced. It can also be done in-house. But change leadership, you cannot outsource. And I cannot tell you how many times I was hired as a consultant by a company to do change management. And when I do my change leadership assessment and I see it's very poor, what this company is trying to do is they're trying to dump everything on you and say, here, Mr. Consultant, do everything for us. It's not going to happen. You know why? Because your leaders are not on board with the change. And without change leadership, nothing gets done. I do understand it's a very easy way out for leaders because they can say, see, blame it on the consultants. We paid them a lot of money. They didn't get anything. So it's very easy for me to get rid of the blame and the guilt, to outsource accountability for those things. But if anything that you're going to remember from this panel, at least from my portion of this panel, is without good change leadership, it's going to be extremely hard to get any type of change done, from smaller scale all the way to complete turnarounds. So if you want to start by assessing your change leadership capacity. And if you do have people who are committed, who are strongly on board, and they want to create some positive, impactful change, this is more than 50% of success. Then all you need is good people to help you with the processes. That's the easy part. So one of the things that I think we are in deeply need in healthcare is to breed this new kind of leader who is willing to be more courageous in that sense and fighting the complacency of the system. We got to tackle this learned helplessness that we have in healthcare. And I'm not, being specific to Kenya here. I'm talking about everywhere. Here in Canada, we're suffering from the same melodies. So we need this new kind of leaders who have the stamina and the courage to shake the system a little bit. And they are willing to take the heat for it because it's not a very comfortable position. You might be at risk politically, you might be at risk sometimes even in your reputation, but without it, the system is going to continue to replicate itself. And we host this panel 20 years from now, and we're going to be complaining about the same things because we still have a system that is a patchwork. So in a nutshell, Dr. Wairima, I'm going to stop here. As I said, I tried to be very brief and concise about change management and psychological safety. And I hope that resonated with you. Thank you.
Thank you, Dr. Chuzi. We have a number of comments already coming in on the aspect of psychological safety. I'm sure you'll read through the comments and you'll be able to see what our listeners have to say about that and their experiences. And with that, I'd like to move swiftly to Dr. Kitulu's session. And during this session, we'll put together what we've learned from Dr. Mukabi and Dr. Chuzi and see how we can practically apply these strategies in our as healthcare practitioners to engage meaningfully in policy spaces, both locally and globally, and all that while still balancing our clinical responsibilities. So Dr. Kitulu, you wrote a really inspiring article with the Strathmore Business School titled Bold Leadership in Action. And you told us about your journey in healthcare, leadership, and policy. There's something that you said, that article, that I'd want you to just elaborate to us. What does it mean to speak the language of policymakers? And why is that important for us to be able to influence policy? And how can we bridge the communication gap as healthcare practitioners with policymakers? All these beautiful ideas that we have, how can we actually get them listened to and actually implemented? And you've also managed to remain so grounded in your clinical practice while undertaking all these leadership positions. Can you tell us how you manage to deliver quality patient care and actively engage in leadership? That would be interesting to hear. Thank you.
Thank you. Thank you, Wairimu. I wondered where you had got that bit from, to speak the language of policymakers, because I said, that sounds like me. So you read my article. Thank you. So what does that, when I come to that, it takes me back to the time when I sat on the National Economic and Social Council as a presidential appointee from KMA. And that was in the time of President Kibaki. He had a private sector team to input and advise government in terms of policy making. So KMA was one of the institutions that was invited, and KMA nominated me to sit on that council. That is when I learned that I did not know the language of policymakers. And indeed, in medical school, we were not taught any of that. I knew very well how to diagnose a patient, how to treat a patient, how to engage in that sector, but not how to speak towards policymaking. And in my sitting in the National Economic and Social Council, I realized that, so the way it was structured, there's the economic pillar, there's the social pillar, and the health policy fell in the social pillar. And you can imagine getting the health issues onto the agenda was always very difficult. The economic side was much easier to discuss infrastructure, to discuss the bonds, to discuss all those things. They were crystal clear in what it meant for policy. But when it came to those of us from the health sector, we spoke more like would speak to the patients, and never aligning what it meant for the policymaker to be able to make a decision. So really then what I learned from my sitting on that council was that we need to use clear, concise, actionable language. We tend to use a lot of medical jargon, which is lost to the policymakers. We have to learn to frame our health issues in terms of impact. For them, they are looking at, is it cost effective? Are there economic benefits? Is it politically feasible? Those are the things that they want to hear. We have to learn to link our healthcare goals to broader policy agendas. So we can't be the health professionals sitting in the background who have no idea what the policy, the political agenda is. You have to be right in it so that you know how to link so that you're able to link your health goals to that policy agenda. In terms of, is it national security, is it social stability, all those things that arise from the political agenda. Then, of course, I think Dr. Chuzi also spoke to the fact that, yes, health is really evidence-based. And so we need to provide those evidence-based recommendations, which are supported by data, but tailored to the policymakers' context so they can understand what it is that we are talking about. And then, of course, there's understanding timing and political landscape. You have to know when to introduce certain ideas and how to advocate for them based on the political landscape. We cannot run away from politics. That is what makes the world go round, and we have to be able to plunge into it. So why is it crucial then in healthcare policy to speak the language of policymakers? Because that's how you influence decisions. That's how you secure political will. I think for a long time, we kept on saying there are so many things that we are unable to achieve because we don't have the political will. But by framing health priorities in terms that resonate with policy agendas, we can gain support and resources. And then there's bridging the gap between science and implementation, because yes, and even right now, if we're looking at our healthcare ministry, the CS, one of the PSS, they're non-medics, but they are the ones who will speak at the cabinet level. You know, they're the ones who are going to sit there and speak. Yes, we have Dr. Luga, and we're glad we have now a medic who will be in there, so that we are able to bridge that gap between the science and the implementation. We translate all that complex research that we are doing and break it into digestible, policy relevant insights, which they can use to then so that evidence can then inform the decisions that are made. And then, of course, finally, we need to advance sustainable change. So policies shaped through mutual understanding between health professionals and policymakers are more likely to be practical, accepted, and enduring. So that little bit, I think it is so critical, yet we sometimes don't realize it. And we then have to realize, and I think for me, I always go back to medical school. I remember one of the lecturers saying the best thing you can learn as a doctor is to know what you don't know. And I think for me, that was the best insight for me sitting at the National Economic and Social Council. I realized I did not know the language of the policymakers. And it's not the policymakers who are going to turn around and learn my language. What I wanted to do, the change I wanted to make, the impact I wanted to have in the health sector involved me having to be able that, yes, I was already on that policy table, but I needed to be able to communicate clearly to make that impact, to make that change. So in that point, then, it led me to some of my next steps in terms of realizing that this was the gap, this is what I didn't know, is then to go out and look for ways in which to bridge that skills gap that I had. And I went to Strathmore Business School, and I've done very many programs with them. I did the effective director, leading healthcare organizations, and finally my MBA in healthcare management, which was just about my best learning opportunity ever, because then it filled in all those gaps that I had realized sitting in all these policy spaces where I had not been able to articulate issues. That MBA in healthcare management gave me the language to comfortably sit and be able to articulate with policymakers, and therefore hopefully make more sustainable impact and change. So in that bit, there are many places, and I think even Dr. Mukabi has also spoken to the programs they have at the School of Government. There's a lot there are many places where we can pick up that information. There's the University of Washington leadership programs. There are so many places where we as within the healthcare sector can step into that space and be able to get that information. So yeah, that's on speaking the language of policymakers. Now, when I come to your second question, which is how can doctors in clinical practice take on leadership roles while still providing patient care? So that's always a very interesting area for me, because most people think that I am not They're like, okay, so you are in KMA, you have been in WMA. We didn't imagine you see patients. I'm like, yes, I do see patients. I am actually in practice. In private practice and have been for the last, this is going to my 25th year. And I continue to practice. And I find that maintaining that balance, clinical practice and being on the policy table, grounds me. I think sometimes when you're sitting on policy tables, there's a lot of theory, there's a lot of discussion, which is all very useful to make change on the national perspective, on the global perspective. But when you have that one-on-one with the patient in front of you, sometimes patients don't work with any of those theories, and it really brings you back down to earth. And you're like, this is the reason I sit in those places, to interact with a patient like this and make the difference for them. So what do I tell people about taking leadership roles while practicing? I think for me, the biggest thing is about what leadership actually encompasses. And I think leadership encompasses purpose and impact. That there is that, what is your purpose? What are you here for? And I think your purpose will be comes from your identity. What are your values? What do you want to see change in the world? How do you want to make this world a better place? And that is so your purpose, what you and your, which leads to your authentic leadership style, is what will drive then the impact that you want to create. So if in your purpose you see that you are one who wants to make you want to drive change, you're innovative, you want to create sustainable progress. I'm always talking about how on social media we can be keyboard warriors and complain about so many problems. I'm not a complainer. I see a problem, I say, am I able to be part of the solution? Then step into being part of that solution. So then that actually a lot of how I've ended up in leadership stemmed from that, because I looked and saw several issues that were within the health sector, and I wondered how do I, as one single person, influence and make an impact in such a broad category. And that's how, being a member of a medical association led into my leadership roles. So I started out within the Kenya Medical Women's Association, where, again, part of this being, leadership is a willingness to volunteer your services, a willingness to just step in and be part of the change makers. So I started off with the Kenya Medical Women's Association, where I chaired that for 4 years. And then from which I was, in a sense, poached by KMA. And in KMA, I started as Assistant Secretary General, and then Vice Chair, and then eventually President. But it's within these spaces of sitting there that I realized that, yes, then you can make meaningful leadership change. And when I got into KMA, that's KMA. Then within my role in KMA, I was made to sit on the National Health Insurance Fund Board, the Kenya Medical Practitioners and Dentists Council, and that is where I realized that some of the things that the challenges I felt experienced in a day-to-day dealing with my patients, that these are the issues that I could bring out while sitting on the policy table as a board member in NHIF, that my patient who needed dialysis was not able to access it. So what are the systems changes that are being made to ensure that is flawless? In terms of doctors' registration, to practice, those who are doing their specialist recognition, in all those challenges, when you're interacting with them from a clinical perspective, and then you sit on the policy table, you can articulate the challenges on that table in a different way. So I would encourage each and every one of us who are here, join your medical association through the committees. I mean, Dr. Wairimi, you're leading, the policy committee. It is by the input that you put into that you begin to make greater impact. It's not enough to have purpose. Your purpose has to have an impact. And it is possible to do both of them. You can practice, you can also be an influencer on the policy side. Some choose to do one or the other, and I think there's no right or wrong way. I have chosen to do both, and I have found a lot of value in that. Thank you, Dr. Wairimu.
Thank you so much, Dr. Kitulu, for taking us through your journey. It's been interesting to listen to where you started from and where you are, and how you've adapted through different seasons in the healthcare space in Kenya. So with that, I'd like us to transition to the Q&A session. We are now open for questions. If anyone would like to ask anything, please type it in the Q&A or in the chat box. We have a few questions. I'll start with you, Dr. Chusi. Someone asks, how should those who are led handle a change management approach that is more of a PR gimmick than actual change management? And there's another question on how do I create psychological safety as I go through my residency in a big referral hospital in Kenya?
So, a few things to be careful here. When you are in a change management process, if you are the recipient of change, so if change is coming to you, you might not be aware or fully aware of all the reasons why this change is being conducted. So to some of you, it might look like a PR campaign because it doesn't make a lot of sense. So one of the things that you can do is to seek for more clarifications on the why, on the how, if has a source of information for that, like a change blog, or some companies change to do, they decide to do like a newsletter or something. So seek for clarifications as to the why for change might help you to understand some of the underlying reasons why this change is occurring now. If you feel like this is this change is not being very effective, or they're missing some blind spots, then I agree with Dr. Kitulu. I think being part of the solution is far more empowering than just complaining about the change. So one of the things that you can do, for example, and I do personally, I reach out to whoever is in charge of the change, if this is coming directly from my supervisor, or if they have a PMO, a change management office, or a project management office. You can reach out and say, hey, I noticed that you're rolling out this big change. I wanted to offer you some insights on some of the things that I'm noticing here on my end, if you don't mind. I'm pretty sure people are not going to say no to that. So it's one good way of you creating, micro changes inside this bigger umbrella and being part of the solution, rather than just sitting down and complaining by the water cooler, which might feel good at the moment, but does nothing to help. Nothing. So I think this is a good way to do so. About the question of psychological safety, here is one of the limitations of psychological safety. It's far more effective when it comes from leadership. So if you have a team, if you're a part of the team and you want to create more psychological safety, or nurture a more psychologically safe environment, well, you can start by encouraging people to speak up. So, that person that never speaks at meetings, you can encourage them to voice their concerns, to ask the good questions. And you can do this on a regular basis. And I can safely say this to you. Just telling people that this is a psychologically safe environment doesn't help. People are very smart. We are very smart. And we have been scolded a few times. And we're clever enough not to expose ourselves. Just because you said this is a safe space doesn't mean anything. It's like those leaders that say, I have an open door policy. And then I ask them, how many people go through your door? I was like, uh-oh. So it's not just saying that you have to reinforce it with your actions. Nothing is going to happen in the first meeting. Nothing is going to happen in the second meeting. Nothing might happen in the third meeting. But if you keep the consistency, and then you encourage them until they are like, oh, you know what? He actually means what he says. Then it's going to become a natural culture of that team to be more vocal about it, to be more safe, to speak up, and to the point where you don't need to say anything else. They already know. So it's much like you got to think more like a gardener in that sense. You plant the seeds, but if you don't water every day, if you don't give enough sunlight, if you don't treat it, it's going to take a while. But once you get there, then you're going to reap all the benefits. But it's a slow moving progress. Don't aim for to create psychological safety overnight, because it doesn't happen like that. I hope that helps.
Thank you. Thank you for taking those questions. We have a lot of comments about psychological safety and the lack of it in a lot of working environments. So it's good to hear what little things we can do to manage our environments. Now I'll pose the second question to Dr. Mukabi. Someone would like to know if the courses that you offer at Kenya School of Government can be taken part-time. You can tell us a bit about the courses that you offer and the modalities of training.
Yeah, okay, thank you, Daktari, and even for the question. Yes, at Kenya School of Government, we have got three modalities of offering our programs. The first being the on-site. The on-site is where we invite you to our campus, and for the duration of the program, then you'll be part and parcel of this community physically here. Then we have what we call the off-site. Off-site, or if you like, outreach, is whereby a set of participants who are keen on having the program mounted within their locality make a request collectively, and then we start making arrangements on how we can mount the program at the point of their convenience. And this has happened for quite a number of medical officers in this region and even beyond. I remember I've done several even in Bungoma, which is on the far-flung part of Kenya. And then finally, this came after the COVID shocks. We introduced the online programs. The online programs is what I could possibly refer to as the part-time, whereby we have a learning management system where certain key programs, management and leadership programs, have been developed and mounted on the learning management system. And those who enroll are able to walk through that program with the guidance of the respective subject experts who meet them on a weekly basis. But this is ordinarily some self-directed kind of learning with occasional wrap-ups between us and participants. This takes slightly longer, but again, it's very convenient. It has actually turned out to be very popular. But maybe what I also need to add on is that this program, there is an expectation. If it is an examinable program whereby like senior management course, then you'd be expected to report to campus for a day or two to undertake your programs and make your research presentations. Then there is the module for the strategic leadership program, whereby you'd be expected to be here for 3 to 4 days on the values and character development module of that particular program. But most of the learning is actually virtually on the learning management system. So those are the three modalities, and I want to believe that we can be able to pick on one that is convenient to each one of us. Thank you.
Thank you so much, Dr. Mukabi. I'm sure those who are interested have taken note. Now, Dr. Kitulu, I'll move to you. There's some heavy questions here, but I'm sure you're up to task. talking about challenges with change management, particularly with the shift from NHIF to SHA. A lot of organizations are struggling. When it came to devolution, there are a lot of challenges, even when it comes to distribution of HR, human resource for health. Some places don't have any doctors, while others have plenty of doctors for their population. And I think what I'm getting from these questions is that people want to know, how can this change be embraced, and how can institutions and individuals in the healthcare space actually adapt to these really big reforms that are coming into health? That is one question. And then the second question is about political influence when it comes to leadership in health. Sometimes maybe you find that someone who's been appointed to a certain docket may not be really up to task with what they're expected to do. And how, us as healthcare professionals, how do we navigate that? How do we still remain relevant and influential, even amongst those who've been given leadership positions, who may not really understand what is going on the ground? Thank you.
All right, indeed, those are some tough questions. I think in terms of the big shift, like from NHIF to SHA, the shift, yeah, that's a heavy one, and yet we are all impacted directly by it. Again, I'll go back to some of the things that I said, that it's so difficult sometimes to make that change as an individual, but you can do it as a group. And that is where, again, I'll keep talking about these affinity organizations, our professional associations, where we can be part of influencing the change through being members of that. I know through KMA, we have the managed healthcare team, and there's a lot they have done towards literally analyzing what are the implications of the new system, what are the challenges, what can be done better. So that's one way, that get into your association, get into those communities, give your feedback. Now, giving the feedback, I know KMA sometimes writes a lot to our members. Come on, this is the new change. These are the policies. What are you experiencing out there? I know we are very good at complaining online and saying, I've put all my complaints online. No, but purposefully respond to those questions, because that's when your representation, that's where your organization goes out to speak for you. So it is important for you to feed it with the information of the challenges that are coming through it. And I like one thing that was mentioned about change management. It doesn't happen overnight. And even that feedback that you're going to give, you may not get a response immediately. By the way, some things you do actually almost get an immediate response, but there are others that take time. So I've watched this whole challenge with SHA and seen KMA give feedback, RUFA give feedback, Kenya Association of Private Hospitals give feedback, and sit in the spaces to ensure that changes are happening. They are not always as fast as we want. Remember, going back to speaking the language of communication of the policymakers, is it aligning with their strategy? Is it aligning with what they want to achieve? So there are so many other dynamics. It's not crystal, it's not black and white. There are so many other aspects to it. So I still feel that being part and parcel of the association, and you giving feedback and you engaging where you need to engage, that is the way to overcome some of those. It's not easy. And even for those who represent us, through the medical association, it's tough. It's tough when you're the one who is sitting there and engaging and giving negative feedback. You're the one who's saying, no, this does not make sense, and this policy, this should be cancelled, and of course the PSO, whoever is looking at you and saying, what do you mean by that? But that's part of where leadership comes in, that ability to challenge the status quo, to be, to go against the grain and say that, no, this, for long term and for the impact to my patient, this is a better way to look at it. But also, on the other hand, to listen and say, okay, for the larger team, I think as doctors, sometimes we think only of the patient that I'm seeing in front of me, but there are millions of other patients out there. So learning from, give and take and listening to each side. Now, your second question was, remind me again, Wairima, sorry.
About leaders who are politically appointed and who may not necessarily have the technical expertise to handle dockets in healthcare, and how we as medical practitioners, the people who are actually on the ground, can still remain relevant and influential amongst these type of leaders.
Yeah, that is an interesting question, and it's going to happen all the time. We'll always have leaders who we feel don't have what it takes, and sometimes it's not within our power to change that sense of appointment. However, I think we can support, and we can be part of supporting such leadership. Though that there's a caveat to that leader also has to be willing to take the kind of support that and feedback that you give. Sorry, they have to be open and willing to take that up. And I think I have found that with my interaction working within KMA, KMA has always stepped out to reach out to the ministry, to reach out to various leaders and say, this, we can support you in this. This is the sort of feedback that we have, and this is what we are thinking. Some have been open, and it was a process that took time, but eventually they begin to say, okay, let's have your feedback, and let's have KMA sit in this space. Let's have KMA sit in that. They realize that it's not about antagonism, it's about learning. But also by providing such visible leadership, I think it also opens up opportunities for members who we think may have the skill to be appointed. That there's a consistency noted, that this organization provides good feedback. It has people who are here to champion changes, who are willing to sit at the table and be part of the change, part of making the difference. So those are some of the ways we can influence the leaders who are appointed and be part of helping them make the change. I know sometimes when I've interacted with those who are from the ministry, they're like, some things we cannot say because of where we sit, but you as a professional associations can say. So maybe that's our role then, to say it for those who can't say it because of just where they are placed, and be part of making those ones change. And I think this cuts across. It's not even just you'll find even on the global perspective right now. I'm sitting in WMA and as president-elect, and you'll realize that yes, there are issues that face us maybe from the African continent, which are a totally different perspective, and the way they had been looked at was, in a different way from the knowledge they had then. But when you sit there, then you can be part of changing that and saying, no, maybe this is a better way to look at it, because this is the way certain situations look at. So again, I think leadership, when you're sitting in such leadership positions, there's issues around understanding the political scenario. What are they trying to achieve, and how do I plug into that? Showing that, but knowing that the final impact for me as a medic is for the betterment of my patient. That there's quality healthcare for all. That there is affordable healthcare for all. How do I get that to that leader to see that this is what we are all trying to achieve, and that it comes up to the same point? Yeah, thank you.
Thank you so much, Dr. Kitulu, for sharing your views. It's not an easy question to answer, but I believe there's clarity that has come with your answer. My next question is to Dr. Chuzi. Someone asks, from your experience, would you say that employing the rules of natural justice is the single most effective approach that leaders could use to foster psychological safety?
It's a good question. It helps, but it's not enough. When you ensure fair participation, I think that's what the participant means when it's talking about the natural rules. From a democratic perspective, yes, it helps as a good start. But that doesn't mean, though, that everybody's going to be, talking. It doesn't mean that everybody's going to raise their hands and speak up. And that could be because they have past leaders, who were not very receptive to this. That could be it's because they are studying your new behavior as a leader. They want to try to figure you out. What do you like? What do you punish? So it might take some time to do that. So it is a good start, but it's not enough, I would say. If you want to foster psychological safety, you have to encourage, you have to shape that kind of behavior. So, for example, a few things that I do with my teams, I can share with you. Doesn't mean they're going to work with you, but some things that I do, either when I have a consulting team or a research team, I tell them beforehand, if I'm calling a meeting, it's not because I want to communicate things to you. I do this via email. If I'm calling a meeting, it's because I need your brains. If I'm calling a meeting, it's because I need your input. Okay. So if I am calling a meeting, either virtual or in person, come prepared to participate because I'm calling you because I want you. And if you're not saying a word during the meeting, something is wrong. Or maybe I don't need you in that meeting, but then you can let me know. So this is one thing I tell them, and I reinforce that every meeting. And another thing I tell them is listen to me, but don't listen to me too much because I need you to disagree with me. Can we all agree in this room that I don't know everything? And if we can all agree with this, then it might be the case where I might missing out on something. I might be missing out on a perspective. And it's your obligation with me and the team to bring that up. So what do I do when they bring that up? I am hard on the ideas and soft on the people. So I say, okay, let's debate this idea. We're not going to debate if Charlotte brought the idea or if Samuel brought the idea. We're going to debate the idea. And then I make this a form of a practice with the team. And again, after a while, yes, roughly you will notice that they start speaking at the same ratio, men and women, junior and senior. It becomes more of a natural distribution, but that doesn't happen by accident. That happened because I was actively nudging them, actively shaping the behavior the way I want them to behave. Again, as you can see, a very insecure leader cannot do this because a very insecure leader can never be challenged, can never be questioned, can never, because he or she wants to be dominant. If you want to be dominant, there's no psychological safety because people they're going to be pleasing you all the time. They don't want to give you ideas, they want to make you feel good. And sometimes making you feel good, meaning I'm not going to say some things to you because that's going to make you upset. And I tell my team all the time, you have to be comfortable with being uncomfortable. You have to be comfortable with disagreeing with ideas. And again, I help them shape that behavior, especially the more junior people in my team, until they understand that there is no, seniority here means something else. It doesn't mean that you have to lower your head and accept everything. And if it's something that is going to be too incisive, I tell them, come to me after the meeting. Let's have a discussion about it. But I still want to hear about it. So the natural rule, it's a good start, like I said, but it's not enough. There's more work to it.
Thank you, Dr. Chuzi. And while we're still with you, could you comment on the emotional side of change management?
Oh, which one? There are so many. I'm going to pick one and I'm going to leave that one with you, though. I've been doing change management for over 20 years. I've been doing this with governments, private organizations here. I've been to Saudi Arabia doing that kind of work. I've been to Germany. I've been everywhere doing this kind of work. There's one thing I learned. You don't have people who, when they are resisting change, they're not doing so because they are bad people. They're not doing so because they are negative. When people resist change, they're doing for a very good reason for them. It's up to you, if you're leading change, to learn what those reasons are. Instead of trying to strangulate resistance, you learn from it. Because they might have a really good reason why they are resisting those things. So if you establish learning mechanisms, I really like, Dr. Mukabi here works with, learning and development. I think this is the approach you should all have. When you're dealing with change management, you should all be learners. Learn why this is happening the way it is. Learn about why these people are not complying with the change. Learn why these people are complying so fast with the change. So they don't resist because they are bad people. It's just that sometimes we're not fully aware of the reasons why. And this is, I think, one of the probably the most emotional as it can get. People get angry with those things. So learn from it instead of just hitting them in the head and silence them.
Thank you so much for your response. I just have one more question, Dr. Mukabi. It's just food for thought for you. One of our participants says that trainings on leadership should be introduced at undergraduate level to basically equip graduates should they immediately land in leadership roles straight from college, like the example that you gave. So just food for thought for KSG about introducing these programs to the universities for undergraduates.
Yeah, thank you, Dr. Wairimu. I totally agree. I remember in one of our discourses with medical officers who had an outreach senior management course program, they actually confirmed that there is hardly much of that practical management skills being undertaken in medical school. And that kind of presents quite a challenge to them once they graduate and they are expected to man some of our health facilities. So it could be a policy issue, and I want to believe Dr. Kitulu can help in that kind of direction, that it could be very useful, for example, if in the curriculum, everything should not just be purely about the technicalities of the work, but they should also be granted an opportunity based on the kind of expectations that the industry has over them in terms of taking leadership positions, that it is infused in the curriculum, so that some of these basics in terms of management, in terms of leadership, then they become part and parcel of what they do, so that once they are out, then some of those challenges that they experience could actually be taken care of. So it would take a slightly wider approach beyond what we do as a school of government. The most we can do, and actually based on our observations, we could initiate some kind of policy intervention directed towards the Cabinet Secretary, Ministry of Education, in terms of just answering that question. How do we ensure that our graduates, once they exit schooling, then they have this kind of practical knowledge to manage and actually to lead? Because I remember we did some management courses, but they were skewed towards the kind of discipline that we were learning at that particular time. So we did have that kind of exposure whereby we have an opportunity, for example, to learn some of these issues like the dynamics within the offices, issues to do with the HR, issues to do with managing resources, issues to do with change management and all that. So those are important aspects that probably in a wider setting could actually support in terms of policy intervention. Thank you.
Thank you so much. That has sparked an interesting thought. Dr. Kiki, the rest of KMA executive can offer more light when it comes to policy shaping in this regard. So that brings us to the end of our webinar. Thank you to our speakers for sharing their insights and their experiences with us today. Thank you for the engaging audience for taking the time to log in for this webinar. I now would like to invite Dr. Kigondu, our president of Kenya Medical Association, to give us some closing remarks before we end the webinar. Thank you.
Dr. Wirumo, I don't seem to see Dr. Kigondu, but you do have a vice president, Dr. Matende, on board, and Dr. Diana Marion SG. Maybe one of them can go ahead and give the closing remarks. Dr. Matende, up for it, please.
I think it was a learning point for me, and I sincerely want to appreciate each presenter for such great wisdom that they have shared, and as well and properly challenged. I think as leadership came, we need to quickly start thinking on how do we engage the authorities be in higher learnings, on how we can have the curriculum's influence to develop medical doctors as persons of leadership capacity that can lead widely beyond just the consulting spaces with patients. I think it's been a wonderful team. I appreciate all the speakers from Kenya School of Government, from my Indami President-elect, and all the other speakers and members at large for having come today. It gives me such pleasure and honor to know that we are keen to be instruments of change. That's the only way we can change this country and we can change our profession. With that, thank you very much and a wonderful evening for all of you. Thank you. Bye.
Thank you everyone for your participation. This webinar has been hosted by the Kenya Medical Association Policy Advocacy Committee, and our aim is to empower healthcare professionals and stakeholders through policy engagement, advocacy, knowledge sharing, and collaboration to support health system strengthening. If you want to learn more about us and other standing committees, please visit the KMA website, and this recording will be made available on YouTube. Thank you for your time, and the webinar has come to an end. Have a good evening. Thank you.
Bye-bye.
Bye-bye.